Hi everyone. Today I will be discussing some key findings from a report on health disparities faced in the South Asian American community developed by the South Asian Public Health Association. South Asian Americans represent one of the fastest growing ethnic groups in the US. The South Asian diaspora represents those individuals with roots in Afghanistan, Bangladesh, Bhutan, India, Nepal, Pakistan, Sri Lanka, and the Maldives, including those from the Indo-Caribbean and the diasporas in East Africa. Critically, they are one of the most understudied populations whose health and quality of life is disproportionately impacted by preventable and non-communicable diseases. So, this review aimed to highlight the landscape of research on sociodemographics, SDOH, and health outcomes in the community. In looking at national data to identify the sociodemographics of South Asian Americans, American Community Survey enumerated 9 South Asian groups. However, more specific socioeconomic and demographic data was only available for 5 groups, which include Asian Indian, Bangladeshi, Pakistani, Sri Lankan, and Nepalese. This national data illustrated various differences among groups, where compared to the general population, the median age was lower. A greater percentage of those were married, a greater percent were foreign born. Bangladeshis and Pakistanis had higher poverty rates and had lower coverage of health insurance, along with Nepalese. And Bangladeshi and Nepalese groups also represented 2 of the lower earning groups. Major areas of research on social determinants of health that were studied within the South Asian community mainly focused on individual level social determinants of health, which included education and income and the role of cultural, immigration, and religious spiritual factors. At the structural level, the neighborhood and built environment, racism and discrimination, healthcare access, and health policies were mainly studied. Social determinants of health were studied with respect to the following health outcomes, including cardiovascular and cardiometabolic conditions, cancer, COVID 19, mental illness, ADRD and dementia, and sexual and reproductive health. However, there are evident lack of research on health outcomes such as trauma and interpersonal violence and sexual reproductive health, and a lack of approaches to address social determinants of health within interventions that aim to improve those health outcomes. So, further, many studies lacked representativeness of all South Asian groups. So, while the collection of national data that accurately represents the diversity of South Asians is very much needed, and existing studies provide valuable insights into the health disparities faced by South Asian Americans, but they usually lacked representation as well of South Asian groups. And mechanisms to enhance representation is needed to address health outcomes and include those underrepresented through policy, funding, and at the training level. Thank you.